We
Good afternoon, viewers, and welcome to Breaking Free, the program where we confront life's deepest struggles and find hope, healing, and restoration. I'm your host, Moses Mulenga, aka The People. Our theme this afternoon is Breaking the Silence. Your voice matters on mental health. Today we are tackling a very important and often misunderstood topic called mental disorders. Many people are silently struggling. Some don't even know they need help. Others are afraid to speak out because stigma. But today we say your voice matters. Joining me in the studio is mental health and clinical psychiatry from Transformational Center by the name of Mr. Ernest Njovu. Welcome to the program, Mr. Njovu.
Thank you very much, Mr. Moses, and thank you to every viewer that has tuned in for this program today. I'm honored to be here. Thank you.
Thank you so much. Let's begin simple, Mr. Ernest. How do you define a mental disorder in a way viewers will understand?
So, mental disorders, these are medical conditions, okay, that affects the way a person feels, thinks, and behaves. That's in a simple and crude definition. An example of mental disorders, we have substance use disorder. We have conditions that deal with psychosis like schizophrenia, brief psychosis. There are so many. There are so many disorders. Yes.
Thank you so much, Mr. Ernest. What actually qualifies a condition to be called a disorder? Because we know for the fact that not every stress or sadness is a disorder.
Okay.
What makes it one?
All right. So, what we initially look for us to clinically diagnose someone with a mental disorder, we look at three important aspects. That is, we look at the dysfunctional, the distress, and the duration. So, what do I mean by these three Ds? What happens when you look at distress? You look at extreme emotional pain that will not go away. That's a distress. Okay. An example of disorders related to emotions or mood, we have depression. We also have bipolar and some of the mood disorders. When you look at dysfunction, this is where a person becomes, is no longer able to function properly. Maybe they can't even perform basic skills, basic life skills, such as cooking, dressing up, or just making a simple budget. Okay? Then when you look at the duration, how long has this person been experiencing such things? So there's always a duration for us to clinically diagnose someone with a mental disorder.
Okay.
Yes.
Thank you so much. Doc, what should one do if you discover that you have a family member or a friend who's not eating, functioning, or talking for weeks? What should be done?
Okay, so with me, I will take it as a family member, not as a doctor.
Okay.
Okay, so what I will do would be, first I will not panic. Okay, I will calm down and then I will observe the person. Okay, so I have to take note on how long this thing has been happening. And when you see to say, okay, this person now, I don't have to force the person, no. I don't have to force the person. Because a normal person, depending on age, they know what they're supposed to do. Okay? So I will not force the person. So, but when I say, okay, to say this behavior is persistent, I can call in for a profession. Maybe I would refer them to somewhere, Chanama OPD, or maybe to the nearest clinic, or maybe UTH. Okay? So there are certain symptoms such as appetite, okay, and also sleep. These signs are things are things that we shouldn't neglect. Immediately we see such things, we should be concerned. So long as you care for that family member, we need to be concerned.
Thank you so much, Doc. How can we differentiate between normal stress and something which is rather a serious mental condition?
Okay.
How can we differentiate normal stress and a serious mental condition? How can we differentiate?
All right. So with stress, I actually like that very question, because it's something that, you know, raises eyebrows. Okay, even in my field, it raises eyebrows to say, okay, how can you differentiate? It's a very common question. So initially, stress, so long as you're a human being, you know, you go through a lot of trials, tribulations, problems, and all that. So you feel stressed, okay? It's normal to be stressed when you have a problem. But that stress should go away immediately you solve a problem, okay? Now, persistent stress, where when you're faced with a problem, that problem is solved, but still you have stress, then there has to be a problem, okay? Then that's not normal stress, because what was causing what people were thinking to say is causing the stress has already been removed, but yet a person still has stress, okay? Now, that stress will go far as affecting your relationships with people, okay? It will affect your relationships at work, all other areas of life, or all those areas that are important to you will be affected. Then to me, that becomes an underlying mental condition that I really have to look into.
Okay.
Yes.
What are some early warning signs that people shouldn't ignore?
Okay. So early signs. Okay. It's really important for family members, even as us doctors, not to neglect any sign, because early detection equal to what better prognosis for a condition. Okay, so the early signs or things that people should not neglect. One, I will speak of the appetite itself. The appetite. How is the person? Is the person eating too much or eating too little? How is the sleep pattern? Are they having enough rest or are they restless? Okay, I will also look at the mood. How is the mood? Like, okay, the mood is labile, maybe they will be sad, and then after some time they will become upset. You know, you can't really know what mood that person is in. Okay. The other thing that I'll look at will be how is this person looking? How are they dressing? Okay. So the dressing also matters.
Okay.
Yes. So if I notice maybe there's what we call a flamboyant dressing, maybe a dressing that is so colorful. Okay, I've seen some people that walk in the streets, you know, they're wearing, you know, yellow trousers, green shirts, you know, orange headsock. To me, I'm like, but why dress up in such a way? It's really colorful and drawing attention. So to me, if I see another two signs, I will start looking for a disorder that a person would have. So even the dressing itself is really important.
Okay. Thank you so much, Doc. Doc, why do you think many people in communities still misunderstand mental health? Because many of the times you find people laughing at it, no anafunta uja, no anasokonezeka, without knowing that you can equally be affected in one way or the other. To some extent, we all have issues which we have to deal with. But many other times we see the communities, instead of supporting, they'll be busy laughing at an individual, laughing at their friends without helping. So how can you help us on this one?
So speaking of community, in the community there's too much stigma. Okay, so many myths. Most of the people in society, when a person has a mental disorder, there's witchcraft, banamloa. those are the common things that people say, okay? And one of the things that I've come to notice is some people, due to stigma, they don't seek for mental healthy services. Such kind of things. But you are the person that is suffering from the mental disorder. So with me, what I would do is that the community really needs a lot of sensitization, okay? So it's no wonder I urge most organizations and mental health activists to do much on groundwork so that they sensitize the community about mental health issues, so that we don't have such stigma, and then we have many people accessing mental health services.
Okay, thank you. For those joining us, you are live on Light TV Zambia. Like our page, follow our page. In the studio, I'm with the Mental Health and Clinical Psychiatry Officer from Transformational Center Zambia. Follow the program, share so that others can also participate. We will open for calls 30 minutes before we end, 20 to 30 minutes before we end, so that you can also participate. We want you to ask questions because you might have a friend, you might have a relative who's struggling. Feel free to ask questions. Doc, yes. Let's now break it down so that viewers will be able to understand the different mental health disorders. Okay. Let's begin with psychosis. Okay. What is psychosis and how does it present?
Okay, so psychosis is a very, very common term I use in my field. So psychosis in a nutshell, or by a crude definition, this is where the brain cannot tell what is real, okay? So now, since the brain cannot tell what is real, a person have a problem in their cognitive functions. So that's inclusive of thinking, then the way they feel and the way they behave. So these three things are affected simply because the brain doesn't know what is real. So an example would be, there are what we call hallucinations, okay? There are 5 types of hallucinations. Yes, 5 because of the 5 senses that we have. Okay, there are people that see things that others can't see. There are people that sniff things that others can't sniff. There are people that feel insects crawling on their bodies that others will not see. Okay, so like I said, 5. There is also, they hear things that others can't hear. Okay, so the whole thing here is, it's not real. They're not there. There is no stimulus that is causing a person. Maybe you can say, okay, kwamburuka kandu. That's why I'm no, but there's nothing, literally nothing. Or maybe there's nothing to see, but yet them they're seeing something that is not there. That's what we call psychosis. Okay. And we also have things like delusions as well. So delusions, this is where a person has got false fixed belief about something. So even though you give them facts about something, they will not believe you because of their own false fixed beliefs. So that's the whole thing about psychosis.
Okay. So to our viewers, if you have a friend, a family member, sometimes mwamvira ati no naona ichi chintu nimvera voice not kuvaseka, what we can encourage you, seek help. There are a number of facilities which can offer necessary help, qualified people, professional people, so that that person is helped. These people can recover once they seek the necessary help. Doc, many people confuse terms. What is neurosis and how is it different from psychosis?
Okay, right. So neurosis is actually an old term. We don't often use it, but it's there. Okay. So the difference between neurosis and psychosis is that for psychosis, okay, a person is detached from reality. They're detached from reality. So it's no wonder we have those things like hallucinations and delusions, okay? But with neurosis, this is where a person is fully aware about reality, but they feel terrible. Okay? So let me underline that word, feel terrible. Eh?
Yes.
So by feeling, we're meaning emotions.
Sure.
So by emotions now we mean mood disorders. So we have neurosis is closely linked to conditions like depression, anxiety, OCD, those kind of conditions. But for psychosis, we have conditions like brief psychosis, schizophrenia, and these other.
Doc, where do we put people don't sleep? Maybe they have difficulties in sleeping. We have people, maybe I'm gonna check 4 hours a day. Others maybe 2 hours a day.
Okay.
It's a routine.
Okay.
They are just like that. Insomnia, so to speak. Where do we put? They are in which category? Is it psychosis or neurosis?
Okay. Yes. So, like we earlier said, we should neglect early signs. Yes. So sleep itself will not give us a concrete disorder. We can't clinically diagnose someone with a mental disorder by just not sleeping. There has to be 2 or more signs that we need to look out for. So maybe a person has got insomnia, maybe they take a lot of energy drinks. We'll just say, okay, for that, we'll just maybe give you medicine that will help you sleep at night.
Okay.
Or we'll tell you to say, okay, don't drink energy drinks at night so that you have enough rest. Okay. Because sleep, we find people that have got difficulties with sleep in people with bipolar type 1, okay, where some of them will talk the whole night. They're too talkative, they are restless, and we can find them in depression. But there are also people that can't sleep due to psychosis, because when they close their eyes, like hallucinations, they'll be seeing things. So even them, they can't sleep. Okay, so just sleep in itself cannot give us more information. It's no wonder we need to look for a little bit more of science. Yes.
Thank you so much, viewers, for following us, for watching, listening to this powerful conversation. We are here to educate so that you also educate other people out there. We are going for a break. We'll be right back. Stay tuned.
Hi, my name is Lynette Chilufia, Head of Department for the Kindergarten section at Christ Life School. Our vision at Christ Life School is to teach, inspire, and acquire excellent education with Jesus at the center. Of everything we do, we aim at nurturing children academically, morally, spiritually, so that they grow into confident and responsible individuals. About our kindergarten section, welcome to Christ Life School. We are able to believe in hard work and excellence. Our kindergarten provides a safe, loving, and stimulating environment where children can grow, learn, and develop important life skills. Our program focuses on early childhood development through play, exploration, and guided learning activities that help children build strong foundation in literacy, numeracy, creativity, and social interactions. At Christ Life School, we help children develop confidence, curiosity, and love for learning. Our caring teachers ensure that every child receives attention, encouragement, and pre-mathematics and science, language and literacy, as well as CTS. We also have music. We also do swimming and other extracurricular activities. We warmly invite you, parents and guardians, to enroll your children at Christ Life School, and we're looking forward to seeing you.
Christ Life School, where my heart is trained. Hands, hope, all in His name. Hard work, now future on display. Excellence in every step I take.
Welcome back, viewers. You are live. We are watching us live on Light TV Zambia. In the studio, I'm with the clinical mental health and clinical psychiatrist officer from Transformational Center. Welcome back once again, Doc.
Thank you.
Doc, what do we mean by progressive disease of the brain?
So, progressive disease or organic disorders. So, this is where part of the brain gets damaged. Okay? So, since part of the brain gets damaged, the cognitive functions, the way of thinking, that is the way of thinking, even the way they feel and behave becomes a challenge. Okay? So, progressive organic diseases or disorders, these actually happen in old age, most of them. An example of such conditions, we can have Alzheimer's disease, we can have dementia, and we can have delirium. Yes, so when you look at dementia, mostly we're talking about people that are above 60 years, probably 65 and above, same with delirium. So dementia is a progressive condition. So most conditions in psychiatry, so long as you don't neglect the early signs, treatment or full recovery is, what would I say? Can be achieved. Okay, so it being a progressive disorder, the longer it takes, the worse it gets. Okay, but the good part about not the good part. The difference between dementia and delirium is that in dementia, it's gradual, like I had said, but consciousness is not impaired.
Okay.
Delirium mostly sudden, and then there is impairment in consciousness. So that's the difference between dementia and delirium. So these are just the mental disorders, nothing to do with witchcraft. Okay, it's just facts, something that you can read about and you can sensitize. Not that no, mambuya banga banabalowa, banambuka mbabeka. No, maybe they're demon possessed. Oh, no.
So basically, like dementia, it's about forgetfulness, isn't it?
Yes, dementia is about forgetting. It's all about memory.
Okay.
Yes, so we have maybe a person will forget about the recent things. They will forget about, even their concentration is affected. So there will be concentration that will be affected, there will be memory, and there will also be poor judgment. Yes, these are things that get distorted, that change about them. Even just a behavior changes.
Okay, Doc, some statistics show that people who are 65 years, that group, you would find at least 1% in that group, maybe a group of 10, you find 1% someone has got dementia, a progressive organic disease of the brain. And then people who are 85 years and above, that category, you discover that 20% of those individuals will have the same condition.
Okay.
And we've seen on TV, we've heard about it, whereby wagwira muntu mungote, they start beating them, they find them naked, because it could be that someone was about to go to the toilet and because they've got a condition, progressive organic disease of the brain. And then they will leave their house, they will maybe move, maybe even 1 kilometer away from where they reside. And we've seen these cases, other people have been killed. What can you advise our viewers? We want our viewers to understand, so that even as individuals, it should start from household level. We begin to teach each other, we begin to embrace our grandparents, we begin to embrace the aged. It is important, because if we are to live without these people, then we will lose out history. So what can you advise? What can you educate the viewers?
Okay, so when you speak of these kind of conditions, right, in the age group 65 and 85, myths have it that a lot of people about that age have already practiced in these other things, witchcraft. So initially when someone moves from home to another place naked, they will say, no, agwa umuntu, nimfuiti huyu. So what I would really urge the viewers that are listening to us and watching us live is they shouldn't act on impulse, and they should not just do things for the sake of doing it. They need to think first, okay? They need to have clarity before they do these things. I've heard of some of them being burned, some of them, being killed, ahead of the recent stories, which is not okay and really unfair. Okay, having the government come into the same matter just to control and to also bring attention to people that they're also human rights. Okay,
Yes.
so one of the things is that for people with organic disorders, already their behavior changes. Okay, what they used to consider normal back then will no longer be normal with them. It's no longer they need proper care.
Sure.
So for people that are lacking this kind of information about organic disorders, okay, they would neglect their, grandmother. Okay, they will ignore those early symptoms, and by the time they see an odd behavior, that would not only endanger the person suffering from it, but also to others. That's when they realize to say, okay, I think here is now a mental disorder that people need to know about. So it's not always supposed to be a tragedy for people to understand, to say such thing exists. Even the community themselves, they need to play a role in knowing these kind of things. How do they know these kind of things? By listening to programs such as these.
Okay.
Yes.
Sure. Thank you so much, Doc. That was powerful. Doc, can you explain personality disorders and how they affect the behavior?
Okay, so personality disorders, these are actually enduring pattern of inner experiences. Okay. Okay, so in a nutshell, how I can say personality disorders, this is a condition where a person will be okay for a little while, but there will be an impairment in the way they think. Okay, some of them may be deviant to the culture. Okay, even the social norms, they'll be deviant from such things. Right? So we've got different kinds of personality disorders. So we have a book that we call DSM-5.
Okay.
So there are 10 personality disorders. Okay, and they're divided into 3. There is cluster A, B, and C. Okay, so for cluster A, we call them eccentric. We have the paranoid,
Okay.
persecutory. Sorry, we have the paranoid, schizoid, yes, and schizotypal. Then for cluster B, we have conditions like the borderline personality disorder. We have histrionic. We also have so let me say borderline, histrionic. Okay, so I will have to go and check on some of them.
Okay.
So for the cluster B, mostly they deal with emotions.
Okay.
And dramatic. This is where we find most women, especially the borderline and the histrionic. Okay. Then for cluster C, we have avoidant and dependency. Those are the kind of personalities we have. Oh, one thing I forgot to mention about the dramatic in cluster B, antisocial personality disorder, which is very common. So for people with antisocial disorder, this is where you find that most of them, they like to be alone. Okay, they like to be alone, and for them, most people that have antisocial personality disorder, they're really quiet, like to be alone, and sometimes they can be irritable.
Okay.
Yes, sometimes they can be irritable. Then for people with borderline personality disorder, this is where they have fear of abandonment. Okay, so for personality disorder, deals mostly with emotions.
Okay.
Yes.
Coming to substance. Substance abuse is very common. How does it become a substance use disorder?
Okay. So substance abuse, okay. When a person takes these, there are a lot of substances that people use. We've got alcohol. Okay, in the alcohol we mean all kinds of alcohol, including tujidi, tuwowo, and all those kind of things. Then we have marijuana. Yes, marijuana, cannabis. We also have amphetamines, caffeine, codeine. There are so many things that people use. Now, for something to be called substance use disorder, this is where a person has been using a substance for a very long time, and it has affected them as human beings, as a human being, in the way they think, in the way they behave, in the way they feel. Okay, so they will have interpersonal problems. They will be having issues with their families. You'll be hearing cases of getting in and out of jail. There will be all sorts of problems due to the same substance.
Okay.
So we classify them as substance use disorder.
Okay.
And in the same vein, some of them will even develop psychosis.
Okay.
Yes, they can have alcohol-induced psychosis and the likes. Yes.
Okay. What is intellectual disability, or rather, in simple terms, mental retardation, and how should families handle it?
Okay, so this condition actually deals with an issue of a person being slow in terms of learning, okay, reasoning, even just doing basic things, okay. It exists, though not very common, but it's there. But I think it's now common now. It's becoming common. Yes. So I really urge parents, okay, to be really observant to their children, because mental retardation or any form of intellectual disabilities, they start in their developmental stages.
Okay.
Yes. So, as a mother, when you notice to say, okay, there are delayed developmental milestones, maybe a child, instead of them starting to crawl at 6 months, maybe they start at 1 year, 6 months, 2 years, you should be concerned as a parent. Not a situation where you just say, this child of mine is very slow. No. You should be concerned. This is where parent training comes in place.
Okay.
Yes. When a child is born, there is what we call they are born with what we call a blank slate. Yes, a blank slate. By blank slate, we mean they completely have nothing in their heads. Everything that they will know will be what they will be getting from the parents and what they will see from the environment.
Okay.
Yes.
Can we link mental retardation to a situation where here is a pregnant woman, and then she's abusing alcohol? She's drinking a lot. You are pregnant, you are drinking a lot. Or maybe abusing drugs. As a result of abusing alcohol and drugs, there's now the brain of a child is not fully developed. Can we link it to that?
Yes. Actually, it's one of the causes of mental retardation. What happens is that you know what alcohol does to the human brain. Yes, alcohol has a very, very huge impact on the human brain. Yes, so you as a mother, your brain will be affected, but it will not only be you. The brain of a child in you has to develop. Okay, it has to develop. But how is it going to develop in its early stages when you're drinking alcohol?
But we've heard about issues where people would encourage women to say, no, mwana kutia kulemushe mmara funika omwako kachiuku vijaso omwako chisko banana, you put also milk and the like. Sometimes the others are encouraged to say take a marula and milk so that mwana akule oina. In the process, we've seen women drinking from 6 to 6. A woman is pregnant and then they are drinking 6 to 6 without eating, without even having a shower. What can you say about that?
So those are just what we call myths. Those are just myths.
Okay.
They are coming from people probably that don't know what mental health is, or what really causes people when they're born to have slowness in learning.
Okay.
Those are the major issues.
Okay.
Yes, sure. Those are the major issues. Because Okay, I've heard some, but not during pregnancy because most of them they avoid. But when a child is born, they tell them no. Kulauka score, the milk you're mixing echo, so that upange milky. I don't know how that works.
Okay.
But for some of them, I think it's just the way of them to drink. Obviously, alcohol will not help you in any way. If anything, it will only increase your blood pressure. So for a woman that drinks alcohol already, when they're pregnant, what would happen? Away from the psychological aspect, okay? Away from the disorders, let's look at it from the medical condition.
Okay.
Now, she'll be drinking alcohol. Now, alcohol increases the blood pressure. Obviously, when one is drinking alcohol, as a result, the blood pressure is going to be increasing. And some of them will not even be going to antenatal for checkups and all that.
Okay.
What will happen? The blood pressure will be rising and rising and rising. Now, after the 9 months has elapsed, they go into labor. They are faced with what we call what we call it. We call it, is it eclampsia or preeclampsia?
Okay.
This is where the blood pressure is high. That's an emergency. Okay, the child has to come out. You only bring complications both to you and to your child.
Okay.
Yes, it's no wonder they advise women not to be drinking when they're pregnant.
Okay.
Yes.
So to our viewers, especially Vazimai, if you are pregnant, avoid abusing alcohol. On a serious note, let's avoid encouraging people to be drinking alcohol. Because if you begin to abuse alcohol, the brain of your child won't fully be developed. As a result, natija brain sizapangika mwifuniko pangikira. Akabado jamwana, they will have a mental disorder, what we are calling here mental retardation. So it's unfair kuvutisa muntu wesaziva chili chonse because of our selfish needs. So it is important that we refrain, we avoid, so that we have a healthy baby who's fully functioning and doesn't have these challenges which we are discussing. Let's talk about bipolar, Doc.
Okay.
What are the signs?
So for bipolar, we actually have two types of bipolar. We have bipolar 1 and 2. So bipolar is actually a mood disorder. Like we say, mood disorder, but here a person will be manic. Okay, they will be experiencing elevated energy, and there will be a little bit of, not a little bit, but there will be sadness. So there will be high mood, low mood, just like that. So for type 1, there is a depressive aspect and a manic aspect. For type 2, there is hypomania and also a depressed mood. So now, I won't go much on it.
Okay.
On the signs. So with the signs, we'll look at it at, would say, mood itself.
Okay.
Some of them, the mood may be, too high, too low. So in short, can be labile. Yes. They will be talkative. They'll be restless. So by restless, they will be, maybe they will hardly sleep.
Okay.
Most of them.
So in short, sometimes umuntu azankara alivokolera uka kamba and then sometimes umzabo mdabu the following day uka lilo vija. Okay.
So but most of the times the restless happens at night. There was one woman I know of, how she used to stay in a camp. She would move at night, maybe at 02. She would move alone, and that neighborhood was not safe for her. She would go just stalking until she was staying with, I don't know if it was her relatives, but she would go to the former husband on foot at night. So that's what it does.
Does it at some point leads to an individual becoming violent?
Yes. So most of them can be irritable. So like I said, the mood is mostly labile.
Okay.
They can move from extreme happiness to extreme sadness.
Okay.
So they can even attack.
Okay.
Most of them.
Before we go for a break, Doc, let's briefly touch on schizophrenia.
Okay.
What is it all about?
So schizophrenia is actually a mental disorder, okay, psychotic disorder. So with schizophrenia, a person will have what we call positive symptoms and negative symptoms. So positive symptoms, this is where a person will have psychosis, like we said. So we'll have hallucinations, delusions. We can have disorganized speech and disorganized behavior. Okay. Then the negative symptoms, we can have what we call alogia, which has to do with speech, poverty of speech. We can also have anhedonia, which is lack of interest. Okay. Anhedonia, this is lack of interest, yes. And then we can also have ambivalence or volition. So for us to clinically diagnose a patient or someone with schizophrenia, they have to have at least 2 episodes of, 2 symptoms or positive symptoms, that is hallucinations, delusions, and at least some sort of, at least 2 to 3 symptoms of negative symptoms.
Okay.
Yes, negative symptoms as well. This thing has to happen for at least 6 months.
Okay.
So before 6 months and the person is still experiencing such things, we will say it's schizophreniform. Okay, we need to wait. So like we said, for us to diagnose, duration is very important. And 3 things, the 3 Ds are very important.
Okay.
Distress, dysfunction, duration.
Okay.
Yes.
Thank you so much, Doc. We are going for another break. We'll be right back. Follow our page, like our page, share it as we conversate on mental health. Stay tuned. Welcome to Light TV Zambia. You are watching Breaking Free. I'm in the studio with the Mental Health and Clinical Psychiatry Officer from Transformational Center Zambia, Mr. Ernest Njovu.
Thank you.
Mr. Njovu,
Yes, sir.
are these disorders treatable?
Yes, they are treatable. So for early signs, of course, when there's, let's say, I'll give an example of a person having a depressive episode, and I'm gonna a depression for one time, they come to the hospital. The treatment or the recovery will be okay. They will have full recovery. Now let's speak about depression that has been there for 2 years. It becomes really difficult, but I'm not saying it's not manageable.
Okay.
A person will recover, but it's going to take time for it to fully recover.
Okay.
And then there are conditions like schizophrenia, just like diabetes, they are manageable. And by manageable, a person is able to go back to work, have a family, and do other things.
Okay. Are there risk of an individual stopping medication early?
So now, yes, they are there. Because, a person will feel better for a while, but the reason why they are feeling better is because they're taking the medication. Now, stopping the medication will require permission, okay, from a profession or a doctor. A professional like myself, I can tell you to say, okay, now you can stop taking the drugs. But if you decide not to take the medicine because you feel better, the relapse is always worse. It's going to be bad. So you need to make sure as you are cutting down on the medicine you consult with the doctor, so that they know how to temper down, because we remove you from higher dose to low dose until complete. Now you can stay without that medicine.
Okay, thank you so much, Doc. Can someone fully recover, or it is a lifelong management issue?
So it depends on the condition. For someone that is involved in substance use disorder, okay, so I work from a transformation center, which is a rehab center. So when a person comes to our facility, okay, due to alcohol-related disorders, what we do is, when we see, okay, to say this person cannot go home, because maybe when we say they go home, they become worse, okay, maybe they're a danger to themselves and to the family, so we have to admit, we keep that person in. So what we'll do is that we'll teach them how to survive on their own. Initially, rehabilitation is all about creating a bridge between home and the hospital, okay? So for such conditions, when we know to say, okay, this person now has become stable and can go back, they can go back and they're fully healed, so long as they don't go back to the alcohol or the things they were using. Okay. Yes.
Let's talk about, you've just touched about it. Now let's go in detail into it. We talk about recovery outside the hospital. Why is it important? Why is rehabilitation important in recovery?
Okay, so like I said, rehabilitation, this is like a bridge between the hospital and home. Okay, so when you go to a rehab center, like transformation center, of course, what will happen is that one, you have people that are trained, okay, to take care of a person with a mental disorder. Yes. So at that facility, there will be what we call pharmacological treatment and non-pharmacological treatment. Pharmacological treatment, this is where we give medicine, okay, medication to a person, okay. Non-pharmacological treatment, this is where we give psychoeducation, group therapy. We can also have, I said psychoeducation.
Yes, please.
We also have a lot of things. Maybe we teach you basic skills, life skills, such as agriculture. We venture you into business, or maybe into things to do with, digital programs, okay, so that we remove that mind of yours that is going to remain idle, so that you think of abusing these drugs, okay. We want to make sure that when you come out of a rehab center, you become independent, you're able to work, okay, to fend for yourself, and you're able to relate with others, okay, so that you don't become a danger to yourself and to people in society. Okay. That's the whole thing.
Okay, thank you so much, Doc. Why is it so important that rehabilitation centers should work in conjunction with institutions like Chinama?
Okay, so as we know, Chinama is the biggest psychiatric, hospital here in Zambia. By virtue of it being that, it's mostly overcrowded, okay? Okay, and they have very few bed spaces. The last time I went, okay, I was working from Chinama Youth Hospital, and the unfortunate thing was that for Ward B, okay, for Ward B, they were doing some renovations, okay, so people with Ward B have conditions such as schizophrenia and other things, okay, but Ward E is specifically for people with the substance-related disorders, okay, but due to renovations, they had to be moved from that facility, okay, E. They had another component there. So what that meant was, for a patient that was supposed to be admitted, okay, this person has become a danger to themselves and to the community, they have to be admitted in the ward, but the ward is full and there are very few bed spaces. What do? So now, this is where rehabilitation centers come in place. They can maybe refer someone to a rehab center, or the family can decide to say, okay, we won't bring them here at Chinama, we can go to a rehab center, such as transformation center. So they come to us, we give them same treatment as the one that do at Chinama Youth Hospital.
Okay. Thank you so much, Doc. One worrying trend is the increasing number of mental health cases, even among women. Why have the numbers increased today?
So initially with women have got a lot of load, okay? One of the things that women suffer a lot in terms of gender-based violence, cheating, even their hormonal changes, okay? They create stress on them. And some of them already have personality disorders, borderline personality disorders. They already have pent-up emotions. So most of them become depressed.
Okay, thank you so much. You are watching us live on Light TV. This is Breaking Free. The phone line is now open. Kindly feel free to call us and ask any question. The number to dial is 0974 57 8988. 0974 57 8988. For those using MTN, the number to call is 0960 74 18 64. 0960 74 1864. Feel free, call us. We are live on Light TV. Ask any questions so that as we are with our able psychiatry officer, you'll be able to answer any questions which you have. So, Doc, what role does substance abuse play in this rise?
Most of the times when someone is stressed, okay, in this kind of life that we're living in, it's a new normal. Everyone is now abusing alcohol. So now here comes a person, okay, a very religious person, and due to the stresses of life, they have failed to cope with that stress, and they think maybe life is not making sense to them. This is where now they engage into substance use. For women, some of them, women like to, I don't know if it's competing with each other, especially on the things that they see on social media. Some of them lack what we call critical thinking, They will look at their friends. Or, of course, women have got what we call a biological clock, okay? So, as the age increases, the needs also increase. They'll be thinking about marriage, they're seeing their friends graduating, and they look at their lives, they feel worthless. And the feeling of worthless, a feeling of guilt, this is a very bad combination in a human being. So as a way for a person to actually cope with that, they will indulge into substance use disorder. And then from substance use disorder, another disorder will come out, okay? So it will be like trying to solve a problem with a problem, which will not work.
Okay, thank you so much, Doc. Your last remarks to our viewers.
So to everyone that has tuned in today, what I would encourage you all is, mental illness or mental disorders, so long as a person has got a brain, a person is prone to have a mental disorder. So the community, you as the community should stop that labeling theory. And by labeling theory, I mean kwambo kushauta or kwambo uza muntu kamba tinofunta punch. What that happens is once a person is told those things, okay, it goes into their subconscious mind. The time when you give them such names, the time they will reach a point, maybe due to peer pressure, you tell them to say uyu muntu amachama drugs, uyu muntu amamamo. Even though the person does not do that, but because of suspicions, what will happen is that a person will be like, manani penta kudala ini. That is much abusive. So what will happen is that the conscience now is dead. They will not know what is right and what is wrong. So it's really important as a community to also support each other, okay? And when you see that someone has got an illness, mental disorders are just like these medical conditions, okay? There's no difference, okay? Physical illness like diabetes, they're just almost the same, okay? So we shouldn't be having so much stigma around such issues. It's because we are having so many suicide cases, people being depressed, So we really need to support each other. Yes, thank you.
Thank you so much, Doc. As we come to the end of today's program, one thing is clear. Mental health is just as important as physical health. If you or someone you know is struggling, please seek help. Speak out. You are not alone. Thank you to our guests for sharing such valuable insights with us today. This has been Breaking Free. I'm Moses, aka the People.